And we're really happy to have on the air today with us too one of the leaders in the whole health management space, also a regular sponsor with us and speakers with us, and that's Cathy Kenworthy, President CEO of Interactive Health. Cathy, good morning.
Good morning. How are you?
I'm doing great. How are you doing?
Great. Thank you so much for having me this morning. I'm thrilled to be here.
Yeah, it's nice to have you. Give our audience a little bit of background on Interactive Health, and then we'll kind of jump into some of the current trends that you see right now.
Sure. Well, Interactive Health has been in and around the space of worksite wellness for well over 20 years. We are very excited that we have capabilities that really span almost every concept within the worksite wellness space, whether it be very comprehensive programs that have very rigorous and very specific outcomes, all the way through to programs that can really be adapted in pieces and parts to meet clients' needs, depending on goals around competitions, the speaker that you were just wrapping up with, and other kinds of programs. So we work with well over 2,000 clients that span every industry and size that you can imagine, and we're really proud of the work that we do on our clients' behalf, and take a lot of joy and passion in the mission of really articulating impact with regard to changing health outcomes in a very specific way.
Yeah, you and your team are really passionate about changing healthcare in America, and talk a little bit about how you see Interactive doing that right now.
Yeah, I mean, I think, you read about mission-driven companies. Interactive Health is a mission-driven company. Every corner of our company is infused with a very personal and very specific desire to collaborate with our clients, innovate with our clients, and actually work very closely with our participant population to help affect change. And so, we always start engagements with our clients by thinking very, very carefully about participation. It's critical that these programs have a lot of reach and that participation stem from very positive motivations and empowerment, a sense of my health is a precious asset, and being able to make change in that health is going to predicate future possibilities in my life. So we're very attentive to, and we're very, very good at helping to generate significant levels of participation. We then work very carefully to translate that participation into a term that gets used a lot in our space called engagement. We measure engagement in a very rigorous way. It really needs to involve significant two-way interaction between an individual and some element of the program in a way that's very substantial, and then we translate that engagement into very careful measurement of health outcomes. How many people a year later have a diminishment in health risk, have an improved capacity with regard to the quality of their health, and ultimately can that be translated into reduction with regard to cost for both employers as well as the employee. And we are thrilled and very pleased when we're able to see through the lens of our client the kind of impact that we're able to have there.
Are these some of the things, Cathy, that make you stand apart from the various other wellness providers in this space?
Yeah, I mean, I think, as I alluded a little bit, but just to make more specific, the sense of personal engagement and personal impact, we appreciate and love and have, great capacity for technology innovation. Our company is a technology innovator, and there are many others that have fantastic capacities and capabilities with regard to technology. We've got Apple Watches. We've got lots of ways to now consider technology in the context of a worksite wellness program. But for us, we believe very passionately that our people and using our own employees in the context of these programs is extremely important to, fantastic execution. The program has got to be something that people want to participate in, and the people that are involved in that are irreplaceable, we think. And so we have a tagline that we've played with called "Your Health, It's Personal to Us," meaning we take this very, very personally. In addition to that, of course, we've got the experience that I've mentioned. We've seen and been part of a lot of different manifestations of worksite wellness programs, so we have a lot of ability to help benchmark, help establish ways to overcome various kinds of challenges that can be out there for different employers. We work very hard to create programs that are flexible, that are comprehensive in terms of meeting clients' needs, and I think we're uniquely capable with regard to that. And then for us, it always comes back to solving a real business problem and having a truly measurable, very specific impact. And so the kind of data that we've been able to aggregate over this period of time gives us a very unique position in terms of being able to, without question, measure the impact and be able to demonstrate that with our clients.
Does making it, talking about being personal, help in the engagement across an entire population, which is one of the challenges. I mean, you've got various different, types of individuals across an employee population. Does that really help you and your clients engage more of the total population?
Yeah, and I think that's an extremely important point, right? How can you make a program scalable with a lot of reach and yet intensely personal? And so, of course, the change that any of us might want to achieve in our life with regard to how we behave, how we manage stress, how we consider activity, how do we plan for our nutrition, all of those things are decisions in the end that are very personal. But we do find that we're able to, with scale, be able to catalyze those changes with individuals, and that's really our goal, to be that catalyst that causes an individual to improve the odds that an individual is going to make a different decision than they might otherwise have done. And so we have a lot of technology platform capabilities that allow us to personalize the work. We're able to establish personal scores and goals with our clients for every individual based on individual health history, based on individual status with regard to health as of a moment in time, and being able to use that to establish appropriate goals. We're always innovating. In fact, we have a very interesting piece of work that we're doing with the Green Giant brand that I'd love to share a little bit more about, that allows us to think in very novel ways about how to help people do something which most people think is hard to do, which is to eat enough vegetables, and to make that fun and engaging and something that is very achievable. So there's a lot of different dimensions to make it personal, but I think that's the key to success.
Yeah, talk a bit about how you see, and you're participating with us at our Private Exchange Forum. You were with us in Dallas too, and we really thank you for that, support and participation. How do you see the integration of health management and private exchanges?
So I think what's exciting is, we've used, and of course the name of your organization puts front and center this idea of consumerism, right? And so individuals being knowledgeable, empowered, capable of acting upon their health, and so that's a mission that you and we are very passionate about. When I think about wellness in the context of private exchanges, I almost think it's the employer version of consumerism. Employers being empowered to seek and act upon a whole range of health plan designs and options, and enable those to be part of how they think about management of these issues with employees. Wellness is an incredible enabler of that. Knowing the status of your employee population allows companies to be able to undertake novel paths, like with private exchanges, like with high-deductible health plans, like with HSAs, like with many of these structures that I think will continue to come into the marketplace. And so the empowerment that I know our organization experiences as an employer and among our client base, to be able to make some of those choices and make them with confidence with regard to the impact on individuals, we're very excited about the kind of strategic role that wellness can play with regard to that.
Yeah, most experts in the field really say that you cannot have a sustainable long-term private exchange model unless you have a good health management component, integrated
right.
with that program.
Yeah, it's interesting how much I hear, and I'd be interested what you guys hear, the degree to which people accept one going with the other in the way that you just said, that the health management aspect is the enabler of allowing versus, somehow I don't need that anymore because I'm going over here to the private exchange.
Cathy, before I let you get off, talk a bit about what you're doing with wearables. I mean, wearables is a hot topic out there. Everyone talks about it. How are you integrating wearables into your program, or what do you see?
Yes.
With
Yes. Yeah, wearables, I think, is the possibilities. I think we've only just begun to scratch the surface of how that can help people consider activity, consider food intake, consider all these very kind of real-time measurements. We're actually exploring certain capabilities even beyond wearables about, state of mind of an individual at a given time and how that can factor into their ability to make positive choices in a particular context. So I think the whole trend towards wearables is extremely positive. The thing that we really are the most excited about within that is through our work to be able to identify and triage health risk, is to be able to spotlight those portions of the population that have the greatest need to be able to connect to the information associated with wearables to make changes. So, we all know in populations there are the individuals who are the ultra marathoners. They know a lot about the status of their activity levels, et cetera. And so those folks, are early adopters of wearables and have a lot of good information, and that would probably be the case with or without an employer program. But there are other individuals in employee programs that have, very low levels of awareness of their true activity level, very low levels of awareness of their sleep habits, very low levels of awareness of certain elements which are critical. And so our coaches are able to work with those individuals to help them create those new habits, create through the information of a wearable device the capacity to take in that information and be able to create new habits and new changes with support. So I think there's a lot of power, particularly in the hands of health experts and health management experts who can work with populations in a very targeted way.
Yeah, just a simple aside, we're involved in a current program here and with some other teams competing, with a program with Withings, and it does engage you personally and as a team. I mean, it really is uniquely engaging and getting you involved in doing things that you should have been doing but maybe haven't been doing. It gives you that extra motivation to reach and exceed some of the goals. So it really is, from my personal experience, it really is a very engaging tool.
Getting those competitive juices going?
Yeah.
Yeah. That's great.
Particularly with my son sitting to the left of me, that's our radio producer. So anyway, Cathy, it's always a pleasure having you on the program, and we really appreciate your involvement with us. And I'd like to give you a few minutes to kind of wrap this up and leave our audience with a couple takeaways, if you would, please.
Sure. Well, thank you so much again for having me on at Interactive Health. We're very, very excited about the early innings of worksite wellness and see just a continued progression around the opportunities to really change people's lives, to really help create new possibilities in the context of positive health. So if anybody would like to come learn more about us, please check us out at www.interactivehealthinc.com. And we'd love to hear from and work with any of your listeners that are thinking about the right way to implement a worksite wellness program.
Thanks, Cathy, so much. Listen, enjoy your weekend up in the Chicago area, and we'll see you real soon.
Take care. Thanks, guys.